Welcome back. We've been talking to Laura King about adult children and siblings of the mentally ill, and let's continue our discussion. We have been talking about issues that come up, and what I'd like us to do is turn now to some of the more specific feelings that you've alluded to a little bit earlier. Okay, let's take a look at our first list. Okay, let's take a look at what siblings and adult children feel. We have here grief, guilt, anxiety, some resentment, we should come back to that, self-doubt and preoccupation, jealousy, stigma and shame, loss of feelings, and a loss of spirituality. So we'll take that half of the list first. And in terms of, we've talked a little bit about grief and some guilt. What about resentment?
Well, what you see is that when a sibling becomes mentally ill, or even a parent has a mental illness, there's a certain degree of resentment that comes with all the attention going to focus on that ill sibling or on the ill parent. So, you know, there's a certain amount of jealousy and resentment. You know, where's my attention? You know, they're getting all the attention, and you know, maybe I'm sitting over here doing good work, and you know, and there isn't any attention for doing positive things.
I wonder, do siblings ever respond by becoming, oh, I don't know, acting out themselves?
Absolutely.
Okay.
Yeah, siblings can respond by they can respond by doing drugs. You know. Or getting into trouble at school, things that pull the attention away from the ill sibling. Or if it's a parent, then that child may act out at school, right, get in trouble at school. One of the ways that you see children try to get attention is through body aches and pains, right? So they compete for the attention in that way.
That makes sense, doesn't it?
Right.
My tummy hurts.
You get tummy aches, you get headaches. Right.
Okay. Well, how about this stigma and shame? You mentioned that before, that sometimes you wonder about what people will think when they find out.
Well, I think that there still is a considerable stigma in our society about mental illness, and that there is sort of this assumption that if someone in the family has a mental illness, and oh, you know, the people around, you know, the brothers and sisters, the parents, there must be something wrong with them, you know, which, you know, completely, you know, isn't true, right? But there's still that stigma, and you know, and I think that that's what siblings and children face as they go out there, and they're thinking about telling a friend, telling, you know, even getting professional help. You know, many siblings do not want to go to a therapist, right, or to some kind of counselor, or even to the school counselor, because they're afraid that that therapist will perceive them as having a problem.
Right, somehow get diagnosed.
Because they're crazy, you know, in some way.
Well, you know, I was at a having dinner with some people the other night. We were talking about that the disservice in some ways psychology has done out of ignorance that we didn't know. We talked about how, you know, autism used to be theoretically caused by the cold mom, and how schizophrenia used to be caused by the bad communication skills of the mom. Moms have taken a serious hit, and the whole idea that somehow if you're depressed, it's because your family wasn't meeting your needs. And so I'm wondering, in terms of this issue, with the emphasis in the last decade on biochemistry and looking at medications, if that has helped at all for siblings and children.
Well, yeah, I think it's been a tremendous help. The information that's come out, the research that's come out, and there's been, our physicians now, our psychiatrists are saying, okay, this is a brain disease, you know, there's less blame put on the parents, there's, you know, so in our society as a whole, more and more people are able to see mental illness as brain disorders, as brain diseases, and there's a little less focus on the family as being the primary factor, or some significant trauma or child abuse or some neglect. you know.
Right.
So it is helping to some degree, but certainly isn't.
No, we certainly have a ways to go, don't we?
Right, right.
Well, even in our own profession, we have a ways to go.
Right.
In terms of, where is it? Oh, I saw loss of spirituality. That was last on our list. Can you speak to that a little bit?
Well, you know, it isn't unusual that when someone in the family becomes mentally ill, whether it's a sibling or a parent, that the other people in the family lose hope and they lose faith, and they ask questions like, well, how could a loving God allow this to happen? So they get angry. They get angry at their God. They get angry at the world around them, and they sort of lose that sense of spirituality. You know.
Yeah, that sense of a positive connection, something that would be helpful.
Well, it's not only even a positive connection with a higher power, but it's also a positive connection with other people, right? Because, for example, many people find their spirituality in connecting with others, being intimate with others.
That's true.
Right?
That's true.
So if I'm not able to do that, if I isolate, if I'm fearful, if I don't allow other people to know what I'm thinking and feeling, right? If I feel ashamed, then I'm not going to have that connection, and I'm going to be pretty hopeless.
Yeah. Okay. Yeah. Let's take a look at a few more feelings before we talk about what to do about this, okay? You've mentioned a hopelessness, a desire to escape, loss of companionship, anger, isolation, and confusion. We've talked about a lot of those. Tell me about the desire to escape.
Well, what we have to ask is, what is it that we're trying to escape from, right?
Okay.
And naturally, we try to escape from the chaos. Maybe want to escape from the pain that we feel, escape from the loss, escape from the guilt that comes up. And so that's what people do. They go into using behaviors and ways of interacting with others that is sort of avoidant behavior, we call it. And that can look like a number of different things. It can be, sometimes you'll have siblings who will just never come home, right? Okay. Or children of someone who's mentally ill that will just stay at a friend's house all the time, right? So that's the way they escape. Or they may escape into drugs and alcohol, right? Or they may move, right? Go to college 3,000 miles away and never come home, right? But what are they escaping from? They're actually escaping from the guilt that they're feeling. Right. There's another way to escape, which actually looks like it's not escape, but it is, and that is caretaking. The sibling or the child that becomes very, very involved in the caretaking of the mentally ill relative is actually escaping from their own lives, their own thoughts and feelings, and very focused on the sibling or parent that's ill. Right, so that's a way of escape too. You lose yourself, you give yourself away.
Yeah, I can see that being lost in service in a way.
Exactly.
Well, let's take a look at what next. Okay, let's take a look at our next list. Some solutions. You've mentioned education, learning about mental illness itself, some grief work, confronting denial, asking for help, some socialization focus, and I imagine that is linked to the isolation that the person may have put themselves through. Removing the mask of victim. Remember that one. We'll come back to that. Improving ways of connecting with others, resources and support groups like the ones you lead. Preparing for future care and interest in activities. Let's take a look. I'm interested in terms of the mask of victim. I mean, what are you referring to there?
Well, what can happen is that along the way, as you're growing up with someone who has a mental illness, you can feel like you're victimized, that you are a victim to this disease in your family, that there isn't help out there. You feel like you're sort of trapped in this prison. And there can be the sense that, I'm helpless, I'm hopeless, right? Take on that stance. And so what happens is that when you go out into the world, go out into, maybe it's college, or going out into relationships, you perceive yourself as a victim. You perceive yourself as sort of helpless, hopeless, right? And that gets played out in every area of your life.
Okay. So it's almost like living through if only.
If only.
Yeah. Okay.
Right.
Now, what about this? The other piece of this that we saw on the list, and it's escaped from my head. But I know that you run support groups through your. Now, you have a couple different ones, or do you have a particular focus?
Well, I run support groups for adult siblings and children of the mentally ill, and for adolescent siblings and children. Okay. And the purpose of those support groups is to provide an environment where siblings and children can come and talk about their thoughts and feelings. They don't have to be alone in this, which is, of course, probably the worst thing that happens. They don't have to be isolated. They can come and be educated about the diseases themselves. Many siblings and children, even as adults, have no idea what to call these symptoms that they're seeing in their parents. All they know is that they've disturbed their life for many, many years. So they receive education, they receive some coping strategies, and very much they receive insight into ways that they keep themselves disabled in this disease.
Yeah, and I imagine it helps to have somebody with the same struggle pointing it out is probably more accurate, or I could hear that differently. I remembered what I wanted to ask you, which is in the adult group, do you talk about future planning if it's your parent or if it's your sibling?
Right. The key to decreasing anxiety and fear about being connected with the sibling or parent or and connecting with the family is to prepare for the future, is to know what's expected of you, to know what resources are available for the sibling who has the mental illness or the parent. So preparation, creative problem solving for the future, that is your lifesaver, right? And that is what is very important that can take place during, in these groups.
Okay, so sort of not waiting for the crisis.
Right, you don't wait for the crisis. Many people feel like they're just reacting all the time, and that's all that they can do, but that's really not true. Right.
In fact, I would imagine, and we're going to have to close with this point, but I would imagine that like any other dilemma, there's obviously a pattern in your own family that if you step out of, you could probably predict.
Yes.
Yeah. Okay, well, I want to thank you for coming in tonight. I really appreciate your expertise. Thank you for joining us. In the upcoming weeks, we'll explore sand play therapy and adolescent treatment. I'm Mary Crocker Cook. Good night.